good morning. It's good to see you. I apologize for starting a little bit late, but here we are. Right here on Your World on Wellness Wednesday. And like I said a few minutes ago, we'll be focusing on neglected tropical diseases on this first hour of the conversation. And then on the second hour, we'll be talking about our kidney health. Because again, like we said, it's Wellness Wednesday and we talk about anything and everything health related. And I know majority of you are like, okay, what exactly are neglected tropical diseases? And I mentioned a little bit about Bilharzia and intestinal worms. Let me tell you, it's a lot. But we're going to learn together on the show. I have fantastic women with me this morning. And on my immediate right is Dr. Mary Nyamongo, who is an anthropologist. I have to say that word, pole, because the term. And she's also a technical advisor, African Institute for Health and Development. Good to have you this morning. How are you doing? Your mic? Watu wa nyumbani wanataka
thank you very much. It's good to be here, Winnie, and we look forward to this conversation. Yes,
absolutely. And it's so good to have you. And we also have Irene Chami, who's the director of programs, The End Fund. Good to have you as well. How are you doing this morning?
I'm very well, and how are you? It's a pleasure to be here.
Let me tell you, before we even talk about Bilharzia, neglected tropical diseases and all those things, I am inspired by what you guys did over the weekend. Do you want to tell us what you did? Because I'm like, hey, how?
I'm turning 60 on Friday, and to celebrate, yes, and also to set a course for women 50 plus, the mental health of women, yes, 50 plus. I did 60-kilometer run in Karen. I was supported by friends and family. We had around 200 people who joined us on that day. 60 kilometers. I did it. You can do it, Winnie.
Just put it to context. 60 kilometers is from here to where?
To past Thika.
Thika
town.
And
running.
She did.
Yes.
And I really enjoyed too.
Yes, I did 21.
How was that?
Oh my God. Blood, sweat, and tears.
All for a good cause.
All for a good cause.
I am so inspired.
All for wellness.
So inspired.
Yes.
Hey. Anyway, neglected tropical diseases. What exactly are they? Let's just understand from a basic level, and then we'll break it down onto the two that we'll be focusing on the show today.
So, neglected tropical diseases are a set of diseases that have been identified and classified by the World Health Organization as diseases that mainly affect the poor and the vulnerable, and where there has been no much attention by governments, by ministries of health, and it's a broad range of diseases. So Bilharzia, which is known as schistosomiasis, and in Kiswahili we call it kichocho, is one of them. We also have intestinal worms, mignon. The English word is soil-transmitted helminthiasis. We have lymphatic filariasis, elephantiasis, where you get swollen feet. Leprosy is one of them. Sleeping sickness is another disease. We also have chikungunya, which we know about now in Kenya. Dengue, we have mycetoma. So it's a range of 21, including snake bites. Actually, snake bites was included not too long ago. It's one of the latest conditions to be included, because one is neglected. If you are bitten by a snake in this country, getting antivenom is a problem. Access to health facilities is a problem. And therefore, this, if you look at the impact of these diseases, it really affects the poor who don't have access to water, clean water, use of toilet facilities. Trachoma is a problem in this country, is one of the conditions. And what characterizes them is the fact that we don't talk about them. There's very little attention to them, and the people who really suffer from them are the poor and the vulnerable.
I was about to ask why are they neglected, but now you have answered the question. So.
In fact, if you look at a lot of people, when you talk about schistosomiasis, they ask, is that disease still existing? When we talk about intestinal worms, when I was younger, many years ago, there was an advert that they looked at people and said, "Well, kuna minyoo." Mimi siwezi kuwa na minyoo. So we think minyoo is for children, for people who don't wash. It's true, but minyoo affect everybody, young, old, adults, working, and therefore we really do need to focus on this. And the impacts we'll talk about later, but they are very common diseases, especially in this country.
It's just that we don't talk about them as much and give them the attention that they need, just like any other disease.
Yes.
I mean, there was a time we were having a conversation still on some conditions that we rarely focus on, but still continues to affect millions of people. And we said now, even something as a headache, someone would say, maybe Nicola malaria, maybe, because we've talked about it
malaria so much, and we end up over-treating, not knowing what we're suffering from. And so we take every opportunity we have, and thank you so much, Winnie, to educate ourselves and the community at large about these diseases, so that people know that these diseases are still prevalent in our country, that communities are suffering, that children are being impacted needlessly with these preventable conditions.
I see. I mean, even before we went on air, remember, we sat here and I'm like, hey, Bilharzia, I can't even remember the last time I heard about it. Maybe like in primary schools, like many, many years ago. But I really understand, when you're saying we need to actually talk about it, because it continues to affect people. Irene, can we look at the numbers? What are the numbers saying? How common is it, despite the fact that we don't talk about it in our day-to-day conversations, say at home, in places of work, or, anywhere?
You'll be very amazed that it's kichocho and intestinal worms are the most common NTDs or neglected tropical diseases globally. For example, if you talk about kichocho, you're talking about over 200 million who are infected globally. If you speak about intestinal worms, 1.5 billion. Now, when we break it down further to the Kenyan context, when you look at kichocho, it's about 9 million people who are infected, and another about 18 million who are at risk.
Oh, wow.
Intestinal worms, the same thing, 10 million infected, about 20 million at risk. I mean, these are diseases that are, are caused by certain situations and factors, or are exacerbated by certain situations and factors. Lack of water, sanitation, living conditions, which really lack of access to, healthcare and services. And so that's why they're really widely spread.
I see that. And just to put it into context, because again, the idea is to get it to because majority of it has, when we're having this conversation, a lot of people say, Izon is about rooms, Izon is a nanny, and yet the people who are mostly affected by it, these are our people, they are our relatives, they are our friends, and like you said, unfortunately, majority of the times the people who suffer from these conditions are the poor, because they do not have the information. Just this morning I was listening to a documentary that was done, say, give or take about 5 years ago, still about Bilharzia. And this person says, mimi nenda shambani na uko shamba hakuna toilet hapo karibu. So, they would ease themselves at the river and then still drink the same water. So to really put it into concept for people to understand, like you said, the risk factors that, might predispose someone to, and then we'll talk about now the condition in itself and what it looks like. Do you want to take that, Irene? And then we'll come back to
So when I talk about kichocho, it's a very focal disease, meaning it's more prone in areas where there are water bodies, like slow-moving rivers or stagnant water. And in addition to that, it's what is being done within those water bodies. So what economic or social activity is happening within that. And then it's also tied to whether there's access to sanitation. So you're out there in the community and you'll notice, there are no latrines, and people will openly defecate or urinate. And then these parasites that are contained in the feces and in the urine gets its way into the water bodies. This is the same water body that children are swimming in, that women are coming to wash clothes, fishermen, you know, they're fishing and earning their income. So when these parasites actually get to the water body, they get into freshwater snails, and then there's release of those mature, you know, sort of worms that now infiltrate into the body while you're doing your activity, while you're washing the clothes, while you're fishing. The same to intestinal worms. You know, how good are we at cleaning, you know, the vegetables that we eat or the food? Do we wash our hands every time before, you know, before eating or after going to the toilet? Because the transmission happens where the fecal matter, you ingest it, and in turn you're ingesting, you know, the parasite, and then the worms begin, and there are various types. I think Mary will be able to speak to the various types of and what signs and symptoms that they portray. So you can imagine that situation at the community level. People do not have access to water, so what they'll do, they'll go to the rivers to get you know, the water that they need to cook, to clean. You know, because of lack of access to water, you're not able to wash your hands as often as is required. You know, we have to really ask those questions. Are our facilities, even in public places like marketplaces, are we providing access to those facilities so that we are reducing infection? You know, at the matatu stands, at, you know, I mean, you name it. Yes. At the hospitals. Yes. I mean, sometimes you'll go to a hospital and there's no facility. There's no water. Yeah. There's, you know, or even the sanitation facilities are really deplorable. So that's why, you know, I mean, when you think about that, that's extent to which, you know, we are prone to infection.
But especially like in primary school, we all learn to wash your hands, right? And even kids know you're supposed to wash your hands. But majority of times, I don't know what happens when we get into adulthood. It's like, you know, you just move about it. In the urban areas, yes, you would see a lot of people very keen on washing their hands, you know, even before eating or after, you know, visiting the toilet and all those things. But in some instances, you know, that is sort of like, we know, but we just, you know, choose
Look at the COVID situation. Yes. I mean, there was this whole buzz about washing hands, but right now, the very containers or stands or taps, I don't know. I mean, even at the, sorry to say this, even at the airport, there's a whole, you know, like line of sinks that sometimes you even want to wash your hands, but there's no water.
It's like we moved on post-COVID, and after this we were post-washing. But yes, Doc, picking up from what Irene has just talked about.
To pick up from Irene is to note that some of the economic activities are necessary. Fishing and rice farming are necessary. So how do we make them safe? And I think that's the area where we need to focus on, that how do we ensure there are facilities for use, that we are not, people are not urinating or defecating in open spaces, and then we end up using the same water. So for schistosomiasis, the main symptoms would be blood in urine or blood in your the fecal matter, and also, so we have what we call also female genital schistosomiasis, where the woman bleeds, and this has been mistaken in the past for STDs, sexual transmitted disease, and therefore there's been a focus on that now, where we're saying that either a woman who has those symptoms feels there is a sexually transmitted disease, it becomes difficult for her to seek care because of the stigma around it. In schisto-endemic area, in Bilharzia endemic areas, what we are encouraging is for her to be tested, so that we can confirm that this is actually a Bilharzia problem, not a sexually transmitted diseases. And if it is sexually transmitted, for her to get the appropriate care. For intestinal worms, when we were growing up, really, I grew up in the village. Having a worm get out and throw it and go to run and go on with your business was okay. We didn't know any better.
The long ones?
Like, the long ones. You just remove and you say, Mommy, I have one. And then I removed one yesterday. But the impacts are dire on children. It actually retards their mental growth. Development indicators are affected, and physical growth. Also, basically, anemia, lack of appetite, and therefore sometimes we see children with distended tummies. There's one case where there was a whole tray of intestinal worms that were removed from a child in this country. So, and it can become very serious for kids. Sometimes the 1, 2 you get, and parents are used to this. My age mates, I'm turning 60. So my age mates, we grew up with removing worms and throwing them in the pit. However, the impacts, and that's where our institutions and the Ministry of Health in this country is really focusing on intestinal worms because of the impacts on child development.
I see that.
And the impacts on child well-being and child growth. And as communities, our activities really expose children and households to this. Irene talked about washing fruits and vegetables, cleaning your hands before eating, after toilet use. And how many of us have gone to schools where some toilets are closed? Those are the teachers' toilets, and then you have 2 for boys, 2 for girls. Your school has 800 kids for an entire population. How many of us have gone to markets? There's no toilet. Bus stations, there are no toilets, and if there are toilets, they are closed. Even petrol stations that were so convenient, nowadays they are closing their toilets. Those of us who travel to Western Kenya at night, we turn the country into infected grounds because we stop anywhere, you rush, and then you come back, you're given 10 minutes. And so as a country, the question we are asking is, are we conscious about how we expose each other to diseases through these actions?
Can we pause on that and really think about that question, and then we pick up from the break?
Yes,
because
please.
I do not want to rush. You'll be like, and then. But yes, and these are basic, and especially when you're talking about sanitation, washing of hands, being mindful of how we're cleaning our fruits and vegetables. Almost everybody will tell you, yeah, we learned about this, we know about this, but then again, the implementation part, of it. So, and the impact, based on what both of you have shared, is really, really dire. So then the biggest question would be, what do we do after we understand where we are at? And all that is coming up after the break. Do stay with us. But if you have a question, these 2 lovely ladies will answer all your questions on Bilharzia, intestinal worms, and any other neglected tropical disease that you want to know about. Send them our way, and that is at NTV Kenya, both on Facebook and on X. But all that is coming up after the break. All right, welcome back. Of course, the discussion continues even during the break. Glad you're still with us right here on Your World on this Wellness Wednesday. And remember, we're coming to you from the Aga Khan University, the Center for Innovation and Medical Education. They were kind enough to host us this morning as we talk about this very important conversation on neglected tropical diseases. And we're taking a very special emphasis today on Bilharzia and intestinal worms. I just talking about intestinal worms, and I remember saying, yeah, you're pulling that tooth, and then you go tell mom, but really, and even the basics, right? What we mentioned earlier on during the first part of the conversation about just sanitation, washing of hands, how we're handling our food, and how that can impact our general health. And Doc, we left at a place where you asked a very simple question and a very powerful question at that. What are we doing? But even before we answer the what are we doing part, are there specific areas of the country that are more endemic? I know we've talked about rice farming, say, for example, right? So are there like specific areas where we need to really put like a special lens and focus on? Irene, maybe you want to take that, and then Doc will come back to answer the question.
Yeah, so, I mean, very interesting question. I'd say that earlier I had mentioned that kichocho and intestinal worms is very prone.
Yeah.
So you can imagine anywhere in this country that there are challenges, infrastructural or otherwise, or in terms of sanitation access and water access, then, you know, definitely it's an area of risk.
Okay.
So at the moment, working with the Ministry of Health, Vector-Borne and Neglected Tropical Diseases Unit, we have undertaken a process where we're mapping, you know, sort of the country. Mapping meaning trying to understand like the prevalence levels within each county up to the ward level, so that we're able to understand, you know, are these diseases found, both of them, in certain number of wards, or is it only one and not the other? Remember I mentioned that Bilharzia is focal in nature, so, you know, the lake region, you know, would be most prone to the coastal region, you know, certain areas there. When you look at Western Kenya, there are some specific parts. Actually, interestingly, the assumption prior to the mapping was that Bilharzia was really not an issue in the Western region. Only for us to discover that, yes, there are pockets where you find Bilharzia. So currently, the coastal, the lake and parts of Western Kenya have been mapped, but there's a process that's ongoing now to map the entire country. So we are able to just understand what are we looking at, and it's really updating the data that has, you know, data that had been collected a long time ago. So we'll be able to really know up to the smallest unit what we're dealing with, and then begin to sort of try and discuss how do counties intervene, how does the government intervene,
and how does how do we intervene as well? And I'll come back to that. And also the urban settings, right? Is that a concern? Also because in urban settings, remember we're talking about there are the high-rise, the nice places, and then there's, you know, we also have the slums as well, and a lot of people, you know, are prone to so many other diseases. So I wonder if that is also a concern for you guys.
They are mapping, there's mapping for urban, they've mapped the entire country, so the data is coming in. But when you're looking at schistosomiasis, it's basically the coastal lake region and the rice farming. So there has been a lot of work done by Kenya Medical Research Institute in the past in Mwea. A lot of work is still going on there because of course, of stepping in water and in terms of economic activity. What I want to say also is that even in those endemic areas for schistosomiasis, it's very focal. It's very specific to an area. And in one of the wards, for instance, Homa Bay, the prevalence was over 60% of the community members. Wow. Which means, yes, so the prevalence varies, and so some areas we are looking at 2%, other areas we're looking at 10%, but in some areas where we have very high levels of infections, there's a ward that is over 60% of infection. But when you look at that ward, and this is where the private sector is important and needs to come in, it's areas where it's not feasible to have pit latrines because of the terrain, because of the rocks under in rock surface areas. So there's need for innovation in terms of how do we best serve this population in terms of defecation and yes.
Yeah.
So some areas we really do have challenges in terms of just the terrain, the context. However, in other areas, cultural socialization where children under tools, how do you support them? We don't have a practice of diapers, and even if we did, they are costly. How do you dispose of their fecal matter, and how do you support them? And just over time, we've grown used to not taking some of these things very seriously, some of these actions and behaviors. So what NFund and AHD is working with the ministry to do, and AMREF and other partners, is to sensitize communities.
Yes.
That it's important for us to ask ourselves, how are we disposing of excreta matters? How are we socializing our children? So that it's not okay not to take care of these things. It's not okay to take the easy route out. If there's a queue at the toilet facility, you just go into a bush and finish. It's not okay. So how we are working with partners to educate. But even if you educate and people know, if the facilities are not there, you'll just be talking to yourself. So working with the county governments and ward leadership to see whether we can increase access to toilet facilities and also water. Clean, safe water. Countries that have dealt with schistosomiasis or Bilharzia and Mignon have just instituted proper clean water systems, have made it possible to have sewer lines, have made it possible for people to have water at home, tapped water, or in a nearby point, water collection point. And that's the investment we'll have to make. There are no shortcuts.
There are no shortcuts. No way about it.
We can talk about it. People will know about it. But if you do not have access to clean and safe water, if you don't have access to a latrine, we shall keep talking. So those infrastructural investments are important. And we have partners. I know the World Bank is investing in water systems. We do need to really pull together to ensure that these services are available, these facilities are available, so that as I talk to communities about wash your hands, wash your fruits, wash your vegetables, cook your vegetables, use latrines properly, those facilities are available. In some of our communities, they are not available. So the importance of availing these facilities cannot be underplayed.
And also, so you've mentioned water accessibility, first of all, and not just accessibility to water, but clean and safe water. And also mentioned terrain. You know, there's some areas where, you know, even constructing a pit latrine is not feasible because the terrain is not accommodating to that. Any other challenge, Irene, that maybe you see when it comes to providing these facilities? Because, like you rightly put, if you talk about it and you do not provide these facilities, then you're not helping the community at all. And then maybe chime into also the involvement of community health promoters, because they are the ones who are in those, you know, communities dealing with the people.
I think Mary has really comprehensively sort of covered some of the areas that we need to really focus on. I think it's really important to make sure that all the necessary factors that contribute to risk and infection are addressed, and looking at how can we as a country, as government, collaborate with private sector institutions, innovative minds, to just think about these particular challenges, especially in hard to reach areas, so that innovative solutions on how to provide the necessary water access and sanitation is thought through. You will be amazed at how innovative companies and people can be and provide affordable actually affordable solutions to addressing these particular challenges. But of course, it requires resources, and we all need to be at the table. You know, the county governments, our national government, we need to really prioritize water and sanitation. Resource, facilities, so that we can alleviate the wanton suffering that of all populations. Because if we do that, I can assure you, we will, the social economic status of the entire population will go up. Okay. And what does that mean? Then they're healthier people. They're able to work. They're able to provide for their families. They're able to contribute to the, to the developmental agendas
to the
economy as a whole. So yes. So,
I see.
And one other thing is, you'll reach out to the community. Look, I mean, the community health worker does commendable job, in terms of reaching communities, understanding, all sorts of, issues and, that households face. And then you can imagine they're there speaking to a household about you need to wash your hands. And yet, as they sit there and they look around, they do not even see miles. They do not even see access to water and sanitation. I mean, and they can see that the basic need of that particular family could be food. I mean, so we really need to come together and really support the work that community health promoters are giving, by also rallying all of us together to be able to support, address those factors that really hinder.
Joining the call. I see that. So the question, what are we doing? Because so you addressed earlier on where the neglect comes from, and yet millions of people continue to be affected by the same. So then, is it time maybe we change the approach, either from awareness to how we prioritize health? What are some of these areas that maybe you see, if we shift to kidogo hivi, we'll get it right?
I think I really need to talk about dignity, especially for anybody. Access to a clean toilet is bestowing dignity.
At the bare minimum,
And I think focusing on dignity for me has been one of the key challenges I have. You visit a household, there's no latrine. A woman has to walk several feet, miles, kilometers to find a place to hide. Even in the informal settlements. I think for me, that in itself is something that as Kenyans, we really need to focus on. There are several interventions we are supporting. We are working with the government from the African Institute for Health and Development through the support of End Fund. We are working with the government towards eliminating both Bilharzia and intestinal worms, kichocho na minyo. This mass drug administration. So through the mapping Irene talked about, we have identified areas that qualify, where we do mass drug administration, where everybody in that community gets access to treatment. For Bilharzia, we use praziquantel, and for intestinal worms, we use either albendazole or mebendazole. This complements the school health program, because we know our school health program distributes mebendazole, albendazole every year. So that for endemic areas, what we are encouraging is, let's not listen to rumors, let's not listen to misinformation, that this is an intervention that will help our communities get through that. But also we believe, Winnie, even if we treat, if we don't solve the source of the problem, we'll still be, it's a cycle, it's a cyclical approach. So we do need to think through and invest in access to clean water. If a woman walks 2 hours to bring water at home. Washing hands is not a priority. No.
True.
Cooking will be a priority.
Yes.
Washing feet will not be a priority.
Not be a priority.
And therefore, unless we have access to clean water at home or nearer to the home, we will be able to resolve this. But this requires real investments. And I want to say that in some parts of this country where we don't have schisto, maybe just because there's water, there's access to water. There are parts of this country where almost all households have running water or running water nearby. But in poor, vulnerable communities, we don't have access to that. So that needs to be something that everybody needs to focus on. And the Kenya Wash Alliance, who is our partner, is also looking at this. For intestinal worms, it's important for us to, we've talked about using shoes. Children are still going to school barefoot.
Without shoes, yes.
And then the other NTD we didn't talk about was jiggers. So again, unless we also begin to look at, shoes is not a status symbol.
No.
Wearing shoes is not a status symbol. It's a necessary investment for parents, for households, for communities. So we need to really focus on what is the source. So if we solve the issue of defecation, open defecation, and for Kenya, middle-income country, 2025, we're still talking about open defecation. We really do need to step up. Because if we solve that problem, then we're also solving the problem of trachoma, which is also still endemic in some parts of this this country. So fiscal investments in putting money on the table and increasing access to clean and safe water, increasing access to facilities, toilet facilities, is something that we need to talk about. And then we can do what we do best. Talk to communities, sensitize households, sensitize children. We are starting early. We are working with school children to educate them about the value of washing hands, washing your fruits before you eat them, washing your sweet potatoes before you chew on them. So we are educating children because we are starting early. But we really do need to make sure these facilities are available.
We in Kenya, we're most known for talking about systems.
Talking systems, policies, guidelines, but how are we implementing them?
Put everything in order. All right, Irene, you want to chime into the same and also focus a little bit on your key priority areas as the End Fund?
Yeah, I think Mary just mentioned it at the very end. I was also saying that it's so important to institutionalize some of the policies that really prioritize water and sanitation access, and and this of course now goes to the leaders, our leaders, that really this is something that needs to be part of your priority, areas, so that you can alleviate the suffering and wanton diseases that access to water. And it's not only even intestinal worms or kichocho. Just doing that could help alleviate even jiggers and many other diseases. So prioritizing that and actually allocating resources and ring fencing those resources so that they are not deprioritized or moved away due to other things. I think that's really one of the things that we need to do. For the End Fund, we are a private philanthropic initiative that really focuses on, for us, we're looking at the end goal. How do we control and eliminate the 6 most common neglected tropical diseases? And intestinal worms, kichocho is one of them. We have trachoma. There is lymphatic filariasis, or what they call elephantiasis, which is found in the coastal region. There is river blindness, which right now we are actually at the end, especially in Kenya, and the process of just developing the dossier for it to be submitted to WHO to confirm that indeed we've eliminated river blindness is ongoing. We also have Kalazar. I mean, I think you've heard about Bilharzia, and sometimes outbreaks. So those are really the six most common. Of course, there are others that Mary also mentioned earlier, but looking at the end, driving out these diseases, because they really. We should not be talking about them in the 20th century.
Yes.
We should not be talking about things.
During break, remember we were talking about in 2025. Why are we still talking about GKS? Why are we still talking about, intestinal? In 2025? We shouldn't. Also speak a little bit on power of collaborations, because there's how, say, your different institutions are collaborating, but also, collaborating with together with the governments as well. How much have we come, and what is it that then we need to put more emphasis on? I know you've ventured a little bit in terms of not just talk. Let's make systems. Let's put systems in place and make sure that they work, right? So then what other ways do power of collaborations, from where you think will help us to even, accelerate the efforts to eliminate some of these neglected tropical diseases?
So for me, there are different aspects to elimination. So you have the supply chain, where the disease, the materials, the tablets have to get to the community. You need partners there. KEMSA is an important partner in this. All this is led with by the Minister of Health, because it's the custodian. But as we know, health was devolved, and therefore the county governments are so critical in this. And even within the county government, then you have the sub-county, the ward, the community health promoters. And I just love the fact that the country has now recognized the role of community health promoters. We also have community disease surveillance officers. We have community health promoters. And so, and mobilizers. And just the value of ensuring that communities take charge. Because people are the ones suffering.
They have the solutions.
And therefore, our efforts have been community facilitation, awareness. Once communities know that open defecation is a problem, they become the policemen. They start walking around to ask, do you have a facility? Are you using it? So if we empower them, give them the resources, the tools necessary, they should be able to do this. So you have your international partners like ENFund, you have the local NGOs, you have the CBOs, you have the communities. Where we really do need partnership is with a private sector. The Council of Governors is on board, but private sector. Can we invest? Can we do CSR around facilities such as toilet facilities in schools, in hospitals, in markets, at home? Can we support communities? Basically, assess the availability of these facilities, see the gaps, and work together to ensure that people have access to these facilities. As I said earlier, I could have the information, the education. If I don't have access, I will not be able to use it.
I like that. Irene?
And I think the power of multi-sectoral collaboration. So looking at health. Health can share the data. And then bringing in education as a conduit for treatment, through schools and stuff. Looking at water, the Ministry of Water, and seeing how they can, analyze both data, wash data coverages versus the intestinal worms and kichocho prevalence within counties, and then prioritizing that. Now we need to go to community X, because when you look at community X, wash access is at 20%, and the disease prevalence of these two diseases is probably at 20 or so percent or 10%. So working together so that we are not just operating in our own silos, but looking at how can we make the greatest impact together, because we all benefit by working together and just moving that forward. So I think the power of multi-sectoral collaboration is key. I think what Mary mentioned about, how can we galvanize private sector investment, and this is something that the ENFund is really doing, galvanizing private investments to be able to put it and invest it in public good.
I see.
So, and then helping to accelerate control and elimination efforts of these particular diseases that really we need to end. Hopefully by 2030, that is really our goal.
You know what, I was actually about to ask that because we have to go on a break, and I really wanted to ask that. What sort of conversations do you want us to have, or do you foresee, say 2 years from now, because it's 2025, like you said, 20th century, and we're still having people being affected by Bilharzia, intestinal worms, elephantiasis, and all this neglected tropical disease. So, and I think I'm going to take that as your parting shots, right? 10 seconds each. Okay, what's quite generous? I mean, 20 seconds in terms of what sort of conversations you want us to have in the next few years.
I think for me, in the next 2 years, elimination, shrinking them up, and if there'll be very few areas remaining, we zero in on that and ensure we do everything possible to ensure that these two diseases, Kichocho and Mignon, are eliminated from our country.
Like that. I think
for me, it's let's take self-leadership. Let us all purpose to do what is right. If and you have the resources available, please avoid just, urinating in public.
Yes.
Deworm. Everybody needs to deworm across the board. For communities that you see, or as you work within your communities, as you come from those communities, if you see that you can probably lend a hand in terms of educating even the community members about the importance, why this is important. Every one of us can play a part. We should not leave it to just
healthcare providers,
the
and development.
No, let's all collaborate together.
That's really my party.
I like that. But thank you so much to both of you really for coming by today, and also reminding us that, listen, this disease, these conditions are affecting real people. Okay, so we need to talk about it. Whatever form of information, not misinformation. Okay, information that you have, and like Irene said, if you can lend a hand, please lend a hand and put systems in place. Make sure these things are working. All right, so that we can help as many people out there. I wish we had so much time to talk about this, but hey, we have to say goodbye to you and then jump onto the next hour on the conversation that is on kidney health. But for now, allow us to say a very, very special thanks to these lovely ladies, Dr. Mary Nyamongo, who is an anthropologist, and a technical advisor, Africa Institute for Health and Development, and Irene Chami, who's the Director, Programs, The End Fund, for coming by today. Thank you so much, and all the very best, really, in your efforts, towards eliminating this neglected tropical diseases. Thank you for your time. And I know lots of people are like, hey, you're in a hospital. What is happening? Those two machines over there. There's no emergency, I promise. There's no emergency. Everything is okay. Remember, we are at the Aga Khan University, and specifically at the Center for Innovation and Medical Education. That is why you hear these machines going on, okay? It's what the students use to learn as far as medicine is concerned. So let's take a short break. We'll see you on the other side, and we'll be focusing on kidney health and why it is important for all of us to also think about that, okay? See you after the short break.